Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry in the Connective Tissue lecture series. So here in this lecture, I will be going over abnormalities in collagen biosynthesis and various disorders that are associated with abnormalities in collagen biosynthesis. Now let's get into the details. The mutations in collagen genes or in genes encoding some of the enzymes or deficiency of coenzymes or cofactors that are involved in post-translational modifications of collagen molecule will result in number of disease conditions, and those disease conditions are mentioned here in the table. So, in the table, the type of collagen that is affected or the enzyme that is mutated is given in the first column, and the second column, as you see, the type of specific disorder for that specific deficiency or mutation is also mentioned. Just to name few, like mutation in type 1 collagen, specifically that alpha 1 chain or alpha 2 chain of type 1 collagen will give rise to osteogenesis imperfecta type 1, osteoporosis, ehlers-danlos syndrome, and 𝗑𝐼𝐻𝐿-𝐴𝐐. Now, how to read this collagen numbering here, that the gene coding for specific type of collagen, I will take the number 2 here, like col means collagen, 2 for type 2 collagen, and the A1 for alpha 1 chain. Similarly, col 3 in the third row is type 3 collagen, A1 for alpha 1 chain of type 3 collagen. Remember, collagen has 3 chains, alpha 1, alpha 2, alpha 3 chains, or it can be any combination 2 alpha 1, 1 alpha 2. Like that, variety of combination of these alpha chains will make different types of collagen. So, every collagen has 3 alpha chains, and so depending on what is the combination there. So that's how you need to read. So let me just take a different numbering, like look at this one. Collagen 4, that means type 4 collagen, A6 indicates it is the alpha 6, alpha 1, alpha 2, alpha 3, alpha 4, alpha 6, that's a subtype, alpha chain. Okay, that's how we need to read this. So here is the table which is mentioning different types of gene mutation that may give rise to different types of collagen associated disorders. Now let's get into some of the selected disorders that I would like to go over here. The first one is osteogenesis imperfecta. Osteogenesis imperfecta, it is also called as a brittle bone disease, and it is also referred as a Lobstein syndrome, which is basically a genetic bone disorder. That means in this disease, the bone is the one which is abnormal, or there is an abnormality related with the bone. It's a genetic bone disorder. So, what is the defect here in osteogenesis imperfecta? The genetic defect is mutation in either pro-alpha 1 chain gene or the pro-alpha 2 chain gene of type 1 procollagen molecule, which is collagen 1A1 or collagen 1A2. As I was explaining before in the table, col 1 indicates type 1 collagen, A1 indicates alpha 1 chain, A2 indicates alpha 2 chain. So, the defect here is col A1, col A2. Basically, type 1 collagen gene is mutated especially for alpha 1 chain and alpha 2 chain in the type 1 collagen. So, the types of mutation found in this disorder, it can be of different types, and one of that, like more than 90% of type 1 osteogenesis imperfecta patients will have reduced synthesis of pro-alpha 1 chain of type 1 collagen molecule. Now, other types of mutations seen are like single base substitution, where a substitution of glycine which appears in every third position, and that is replaced by a bulkier side chain amino acid like tyrosine, tryptophan, something like that. So these mutations compromise the structural integrity of the triple helix, causing disruptions to the helix folding, retention of the mutant trimers. These are insoluble aggregates, and these insoluble aggregates will be accumulated in the endoplasmic reticulum, that is rough endoplasmic reticulum, and that will be eventually degraded. This type of degradation of insoluble aggregates in the lumina of endoplasmic reticulum referred as a protein suicide. Coming to signs and symptoms of osteogenesis imperfecta. The central feature of osteogenesis imperfecta is a severe decrease in bone mass, which is referred as osteopenia, and this makes bones brittle due to alterations in the interaction between collagen fibrils and hydroxyapatite crystals that form bone. So that's why this disease is referred as brittle bone disease. And also, the appearance of popcorn-like deposits of minerals in the X-rays of ends of long bones is one of the sign that is seen in osteogenesis imperfecta, and that is an ominous sign, meaning it is a sign that is dangerous, indicating that it's a severe condition. And disorder is frequently associated with blue sclera. Look for that. And patients with osteogenesis imperfecta will have a dental abnormalities, which is referred as dentinogenesis imperfecta. The teeth may have a characteristic amber or yellowish brown or translucent bluish grey color because of deficiency of dentin, that is rich in type 1 collagen. That's why there will be changes in the dental composition there, and that's the type of dental abnormality you see in osteogenesis imperfecta. Also, patients will show progressive hearing loss, and the loss can be conductive hearing loss or sensory neural hearing loss, or can be mixed, and it can vary in severity. Patients will also show positive family history. Coming to types of osteogenesis imperfecta, there are up to 7 types of osteogenesis imperfecta, and they can go from type 1 to type 7. Let's look into details of each one of them. So type 1 osteogenesis imperfecta is the mildest form of bone deformity, and most patients have distinctly blue sclera. Dental abnormality is seen in some of them, and hearing loss is present in most of them. That's what is the characteristic of type 1 osteogenesis imperfecta. Type 2 patients have a lethal bone deformity, and this bone deformity can be in utero or shortly after birth, and most patients have distinct blue sclera. Dental abnormality is present in some, but hearing loss is not known in type 2. And type 3 patients, they will show severe bone deformity, they will show bluish sclera at birth, and some patients will show dental abnormality, and they will have high incidence of hearing loss. Coming to type 4 to type 7, they will show moderate to severe bone deformity, but blue sclera and dental abnormalities are absent from type 4 to type 7. So these are some of the characteristics of osteogenesis imperfecta. Coming to ehlers-danlos syndrome. Ehlers-danlos syndrome, these are group of inherited disorders caused by genetic defects in proteins that are involved in synthesis and assembly of type 1 collagen, type 3 collagen and type 5 collagen molecules. The principal clinical features that are seen in Ehlers-Danlos syndrome patients are hyperextensibility of the skin, abnormal tissue fragility and increased joint mobility. The clinical picture is variable, reflecting underlying extensive genetic heterogeneity seen in Ehlers-Danlos syndrome patients. So based on that, Ehlers-Danlos syndrome patients can be classified into 6 subtypes, and that is done by Will-Francis classification. So here is the table that will show Will-Francis classification of Ehlers-Danlos syndrome, which is classifying Ehlers-Danlos syndrome based on the major signs and symptoms into hypermobility type, classical type, vascular type, kyphoscoliosis type, arthrochalasis and dermatopraxis type. So this is Well-Franchi classification where 6 subtypes are based on the phenotype and molecular defects that are seen in Ehlers-Danlos syndrome patients. So hypermobility, vascular and classical subtypes are more common, while other 3 like kyphoscoliosis, arthrochalasis and dermatopraxis are extremely rare conditions. And also the vascular subtype is most serious of all types because of its tendency for spontaneous rupture of arteries or the bowel, reflecting abnormalities in type 3 collagen molecule. Remember that. So the vascular subtype is the most serious and will show major signs and symptoms in Ehlers-Danlos syndrome patients. And also patients with kyphoscoliosis exhibit progressive curvature of the spine and a tendency for ocular rupture due to deficiency of lysyl hydroxylase enzyme and also deficiency of procollagen N proteinase enzyme, which is referred as ADAM metallopeptidase with thrombospondin type 1 motif, causing formation of abnormally thin irregular collagen fibrils, which results in dermatopraxis, and it is manifested by marked fragile and sagging skin. And that's what is a finding that we see in dermatopraxis that we have seen in the previous slide here in this table. That's the dermatopraxis in the last row there. Coming to 3 major signs that we see in Ehlers-Danlos syndrome patients. So Ehlers-Danlos syndrome most typically affects joints, skin and blood vessels. And EDS, it is characterized by hyperelasticity of the skin and hypermobile joints. And the classic and hypermobile types of Ehlers-Danlos are the most common types of Ehlers-Danlos syndromes as per the Well-Franchi's classification. Now let's look at the major signs and symptoms of Ehlers-Danlos syndrome. So the first one is ligament and joint involvement. There will be laxity and hypermobility of joints, which can vary from mild to irreducible dislocation of hips and other large joints can be seen in Ehlers-Danlos syndrome patient. Remember that. And the skin involvement is dramatically hyperextensible skin, which is sometimes referred as rubber person syndrome, or easily torn or scarred skin, which is kind of referred as cigarette paper scar, is one of the finding that Ehlers-Danlos syndrome patients will show. And the other finding is easy bruisability occurs in several types of Ehlers-Danlos syndrome. Mitral valve prolapse and hernias, mild to moderate scoliosis and degenerative arthritis is also seen in Ehlers-Danlos syndrome patients. Coming to classification of Ehlers-Danlos syndrome based on the inheritance pattern and also typing them from type 1 to type 7 and type 9. Type 1, type 2, type 3, type 4 and type 7, all of them follow autosomal dominant inheritance pattern, while type 6 will follow autosomal recessive inheritance pattern, while type 9 will follow X-linked recessive inheritance pattern. So this is as per the inheritance of Ehlers-Danlos syndrome patients. Now let's move on to see Alport syndrome. Alport syndrome is a rare genetic disorder characterized by progressive kidney disease and abnormalities in the inner ear and eyes. So these are the organs that are involved in Alport syndrome. One is a kidney involvement, ear involvement and eye involvement. There are 3 genetic types of Alport syndrome. One is autosomal dominant type of Alport syndrome because of mutation in type 4 collagen, specifically alpha 3 and alpha 4 chains of type 4 collagen. So which can be written as col4A3 and col4A4. That is collagen type 4 collagen alpha 3 and alpha 4 genes are mutated. So one is following autosomal dominant pattern of inheritance, that is AR, and other is following autosomal recessive type of inheritance pattern. So we have autosomal dominant Alport syndrome, autosomal recessive in Alport syndrome. In both the condition there will be mutation in type 4 collagen, alpha 3 and alpha 4 chain. So in X-linked Alport syndrome there will be mutation in type 4 collagen but alpha 5 chain. That's the difference there. That is X-linked. So X-linked Alport syndrome, there is alpha 5 chain of type 4 collagen is mutated. Now out of all this, that is autosomal dominant Alport syndrome, autosomal recessive Alport syndrome and X-linked Alport syndrome, X-linked Alport syndrome is the most common one. The first sign of the disease is hematuria and it is accompanied by ocular lesions and hearing loss, and patients may eventually develop end-stage renal disorder. Now coming to Goodpasture syndrome. Goodpasture syndrome is referred as anti-glomerular basement membrane antibody disease, that is anti-GBM antibody disease. It's an autoimmune condition that affects lungs and kidneys, and it is characterized by pulmonary alveolar hemorrhage and glomerulonephritis. And the circulating antibodies in this disease will be directed against alpha 3 chains of type 4 collagen. So the type of collagen that is affected in Goodpasture syndrome is a type 4 collagen, specifically alpha 3 chains of type 4 collagen are destroyed by the autoantibodies. So rapidly progressive glomerulonephritis and pulmonary hemorrhage is seen, bleeding from the nose, blood in the urine, respiratory problems, anemia, chest pain and kidney failure are the signs that we are going to see in Goodpasture syndrome. And in Goodpasture syndrome, the genetic susceptibility is HLA-DR15, environmental insult like smoking, infections, exposure to certain drugs can initiate anti-GBM antibodies. Diagnosis is confirmed by anti-GBM antibody in the blood, and the treatment of choice in Goodpasture syndrome is plasmapheresis in conjunction with prednisone and cyclophosphamide. This is what is the treatment for Goodpasture syndrome. Coming to epidermolysis bullosa. Here the skin breaks and blisters as a result of minor trauma. The dystrophic form is due to mutations in type 7 collagen coding for alpha 1 chain. So that means the gene that is mutated here is col7A1, which affects the structure of type 7 collagen there. This collagen forms delicate fibrils that anchor basal lamina to collagen fibrils in the dermis. So these anchoring fibrils have shown to be markedly reduced in epidermolysis bullosa, probably resulting in blistering. And epidermolysis bullosa simplex is another variant which is due to mutation in keratin 5. Coming to scurvy. Scurvy is because of deficiency of vitamin C, that is ascorbic acid, and deficiency of ascorbic acid will result in decreased activity of prolyl hydroxylase and lysyl hydroxylase, and these two enzymes are necessary for introduction of hydroxyl group to randomly selected proline and lysyl residues in a procollagen molecule. Thereby more hydroxyl groups are introduced to make more hydrogen bonds in a triple helix, so that triple helix is stabilized. So the vitamin C is a coenzyme for these two enzymes. Deficiency of vitamin C will lead to decreased activity of these enzymes, thereby decreased hydrogen formation, bond formation in a procollagen molecule, and that will lead to impaired collagen synthesis, and that can lead to some of the major signs that we see in scurvy, that is bleeding in the gums, bleeding in the skin like subcutaneous hemorrhages, pore wound healing process, bleeding in the joint space. These are some of the signs we see in scurvy. Coming to Menkes disease. Other name for Menkes disease is copper transport disease or steely hair disease. It's an X-linked recessive condition, and that is because of defect in copper binding P-type ATPase, and the gene that is mutated here causing this disease is ATP7A gene mutation, which is coding for P-type ATPase in the intestinal cells. So because of this, what will happen? The dietary copper which is absorbed in the intestinal cells is not transported into the portal blood because the copper transporter, which is P-type ATPase coded by ATP7A gene, is mutated here. Thereby, copper is not transported into the portal blood. So that means there will be a lot of copper being accumulated in the intestinal epithelial cell, and there will be low serum copper present in the blood and also other organs. So there will be more copper in the intestine and less copper in other organs and also in the serum. So all copper dependent enzymes and processes will be decreased in Menkes disease, and that results in defect in the collagen cross-linking process and elastin maturation, because both collagen and elastin maturation process needs lysyl oxidase, and that's a copper dependent enzyme. So because of this, there will be sparse and coarse brittle hair, growth failure, deterioration in the nervous system, and eventually it leads to death. So that's what is a Menkes disease about. Coming to chondrodysplasias. Chondrodysplasias are referred as skeletal dysplasias and are heritable skeletal disorders that are characterized by dwarfism and abnormal body proportions. The mutated genes in number of patients with chondrodysplasias have not yet been identified, but series of chondrodysplasias are produced by mutations in type 2 collagen, especially alpha-1 chain of type 2 collagen. So remember that point there. So this is all about a variety of disorders that can arise because of abnormalities in collagen biosynthesis. I hope this lecture has helped you in understanding how changes or abnormalities in collagen biosynthesis may lead to or may give rise to different types of disorders. Thank you.